2021 was the deadliest year for fatal fentanyl drug overdoses in Nashville, far surpassing 2020. More than 700 people died from this potent synthetic opioid. Welcome to News 2 at 5. I'm Haley Wilkes.
And I'm Bob Mueller. There is fear the upward trend will continue into 2022. Alex Dennis has a look at these numbers, including where the problem is most prevalent. Alex?
Well, Bob and Haley, while the issue of deadly fentanyl overdoses touches every area of Nashville, there are 3 zip codes in particular that have seen the majority of cases. 712 fentanyl drug overdose deaths were reported in 2021, representing a 15% increase compared to 2020, which was previously the deadliest year on record with 621 overdose deaths. Michelle Doobie, the chief clinical officer for Landmark Recovery, a local addiction treatment center, has seen a steep jump in cases following the onset of COVID.
We're coming out of what feels like a never-ending change to society as a whole. And when people are struggling, they seek kind of easy, comforting solutions.
Fentanyl fits the mold. It's potent, cheap, and easily accessible.
There's clandestine labs that are producing this domestically. It's no longer something that's having to come over to the border. We can make this in our own country.
Doobie explains fentanyl has poisoned almost every part of Nashville, which can be seen on this map provided by the Metro Nashville Public Health Department. This one showing the areas most impacted in 2020 as compared to 2021, where more than 40 deaths were reported in Madison, Antioch, and South Davidson County.
This fentanyl trend is definitely the newest. We've kind of got to get an understanding, where is it being produced? How is it being produced? You know, much like we learned about meth labs when meth labs were real big, but it is ever changing.
Combating the problem starts in the community. Doobie stressing the importance of approaching the problem from a non-judgmental place and taking steps personally to be a part of the solution.
I think the other thing as a community that we can do is become educated on anti-overdose medications and carry those. I carry naloxone with me. I've been trained on it. Anyone can be trained, and it saves lives.
So additional key points from the data released: 67% of suspected fentanyl drug overdose deaths were males, while the majority of deaths occurred among 35 to 44-year-olds. Bob and Haley.
Thank you, Alex. Metro Public Health also tracks non-fatal overdose emergency room visits. The number was down a minuscule amount compared to last year, just 8 fewer visits. But look at the jump between 2019, nearly 1,000 more people went to the ER with suspected overdoses in 2020 and 2021. 61% of the ER visits involved non-heroin opioids in 2021. The number for heroin-related overdoses was 34%, suggesting a shift away from heroin to synthetic opioids. That's according to Metro Health.
If you or someone you know is dealing with substance abuse issues, you can call or text the Tennessee Red Line. It's available 24/7 every day of the year. Just call 800-889-9789 or text that number 24/7.